Hey guys, welcome to season 10, episode 7 of Grey's Anatomy. Here we go. Or not. We're having a malfunction. Oh my god. Okay. Jesus.
You don't have to leave.
It's okay.
You want some breakfast?
You don't have to do this. I totally agree with you. This is casual. It's not about snuggling in the morning. It's easy. That's me. Easy peasy lemon squeezy. Gotta go find a costume for this thing at Joe's tonight. So.
A costume?
That's right. It's Halloween.
Halloween?
Happy
Halloween.
Every Halloween, we make a choice about what kind of costume we're going to wear.
Speaking of Halloween, y'all should go to Nashville. Halloween 2025. Because I'm going.
But I need to get on the phone and order a 3D printer.
You're going to get a print.
Okay, well, this will only take you 4 minutes.
I know, I'm just telling you about my day.
Oh, well, I did not factor that into the schedule.
And Trick or Treat still on tonight?
Oh, of course, of course.
Maybe we'll be someone scary.
Alex.
No.
Did you get the pumpkins?
No.
Did you put up the spider webs?
No.
Then how is the house ready?
I got the cake.
Wait, you're having a party at the house?
Yeah, Alex is letting us use the house to trick or treat from because we have no neighbors where we are. So I invited a bunch of families from the daycare. He didn't tell you?
No.
Oh, you should come.
That's fine.
Right.
What is
you don't want to be
this,
around a
like,
bunch of kids
downfall
off
of
the
y'all's
function anyway,
friendship?
Right.
I should have invited you. I'm sorry. I just thought, but you should come for a drink. It's at 7. She's gonna be a butterfly.
Or you could be a superhero, which is what I'm trying to be this year.
How many fingers? 3. Hangnail on the index finger.
Leah.
Well, your uncle probably came back to work too early and didn't take the 2 days off that the doctor recommended.
I am a second-year resident. 16 hours is already more recovery time than I can afford. Go work. Leave me alone.
Alright. This relationship is honestly lasting longer than I expected.
And I have extraordinary vision, literally and figuratively. Come on, time to go round on lever.
Are you sure you don't want to go home?
Hey, kids. You got Halloween plans?
I'll take it. Yeah, Matthew's having a thing. I'm going as a bunny.
Oh, Playboy.
Velveteen.
Nice work. What about you, Lone Ranger? Are you and Emma going out?
Emma and I are no longer a thing.
What?
Emma doesn't think so, because I never mentioned being married before. She said, call me when you're ready.
You're ready. Don't you think he's ready?
Well, maybe he's ready, but he's not ready to call.
What's the difference? He's ready. You should...
Hey, I have the costume in my car. What time do you want to meet?
No, I have the costume.
Oh, please don't tell me we have 2 astronaut costumes.
We don't. We have a princess.
What? No. She told me she wanted to be an astronaut, and that's why I spent 3 hours last night sewing patches on a little tiny flight suit.
Well, I spent the night gluing daisies on a tutu.
Fine. We can hold up the costumes, and she can decide whose work she loves more.
Oh. You know what? Forget it. You take her.
It's on.
I'm not doing this.
Are you serious?
That's the grade.
That is amazing. That's amazing.
Dr. Weber wants one of us to do his surgery today.
Not you. No offense, but I heard you walked into a wall this morning.
Why not me?
Well, you can supervise. They know this procedure inside out. They're ready.
I beg to differ.
Creation through the posterior wall.
What about the posterior approach?
That is a single gastrotomy in continuity with the pseudocyst.
Very nice. And which is the easiest approach?
It'd have to be the intraluminal approach. Unless you're a fan of intraoperative bleeding, in which case, do what you like.
They watched them in the ER today. Tell me which one deserved it.
None of them do. And I don't need to spend a day in the ER.
Dr. Bay, that's all. You get out of here. We're going to review the intraluminal approach.
We should think of costumes that have 3 parts, like the 3 Stooges.
I have a witch's hat. I put it on every year and call it a day. My day is going to be about which of those 3 residents is going to kill the most important patient I've ever had.
Halloween was kind of my family's thing. Come at the end of the day with that face and that body and I'll figure out what to put on it.
Okay.
It's a holiday for children, you know.
Victor Brown, 30-year-old male mauling victim. Vitals are stable.
Let's get into trauma.
Mauled by...
And he started eating my food. It's some sort of
Zombie?
The fighter, multiple kills, W to the chest, 1590 over 60, pulse in the 120s. He's under that.
One stated now, that's capped by Paolo.
This guy should not be alive. The guy's fucking barely hear his heart.
Oh my god!
Patch me up. There's no way I'm missing out on Weber's surgery because of a little neck lag.
Oh, yes, you are.
Where did you come from?
I'm everywhere, and you are not going into an OR with an open wound. You need to get yourself tested and run an infectious panel, including rapid HIV on him and whoever's blood was in his mouth.
Hold up.
Is that a tooth?
Is that tooth?
One down.
Technically 2 down.
Well, first of all, the x-rays are backwards.
No, they're not. Your organs are.
No way.
What?
He has situs inversus?
All his organs are completely backwards, mirrored to the normal position. This guy was shot twice in the chest, didn't die. Murphy could barely find a heartbeat, and it turns out his heart was on the other side.
I have wanted to see this since med school.
What?
Well, we had some candy last night during the movie, and she got sick a few times.
Candy for dinner. Nice.
Ow.
She has some guarding and a fever, so...
Correct, stop being freaking
do further testing.
pissy.
I still get
Your girlfriend is beautiful.
right?
Are you kidding?
Then why didn't he die?
I've got a needle right next to your face. I need you to calm it down,
Is
okay?
there any pain elsewhere?
Sore. It's stiff. Oh my god. Is this rigor mortis?
Victor, squeeze my hand. Did you hit your head when he attacked you?
You smile for me, buddy? She says it is a bug bite or something that got infected, and she says it hurts like that. She's been popping ibuprofen like it's candy. I'm gonna drag her in there.
It's fine.
Not until you let her check it out.
Just try to relax, okay? I'm gonna take a look.
When did this happen?
About 4 months ago.
4 months?
4 months ago?
Pulsing. You know what maggots are?
At first they were a little bit blurry because my eyes, I just had our surgery.
What? What are you doing here?
I'm fine,
You shouldn't be seeing patients.
but I want to be helpful.
Well, great. Then you can go to the store and buy some Halloween candy.
You're looking for what again?
You know, one of those little head mirrors that doctors wear.
Ben, you are a doctor. Have you ever worn one?
No.
Because they stopped using them a century ago.
But Tuck wants to be a mad scientist tonight. He should have one of those little head mirror things.
Well, I have a brain in a jar.
I want to give him a costume, not a nightmare. What did he do to you?
George and I are working on thought control prosthetics. Trying to figure out a way to insert the sensors to a smaller cranium. Oh, well, that's for Zola tonight. It was ripped and fixed it.
Yeah, if you call this fixed. Yeah, I could do a running whip stitch so smooth, butterfly would never even know there'd been a rupture. What are you teaching up here?
I would like to take a biopsy to see if the infection's gotten into the bone.
And we're gonna need to take you down to the
She's probably gonna lose her leg.
That's out of that wound.
No, needles. Just go away. Just leave me alone. No, just go away. No.
I don't want to sound cruel, but can't you just put her in restraints and give her a sedative or something?
I have an idea. I'm going to the gift shop. I'll be back.
What's in the gift shop?
What's your doctor's name? Maybe I can find them.
Dr. Brooks. Heather Brooks.
I'm sorry, she's not here.
Yes, she is. She's always here.
She's pretty insistent on seeing Dr. Brooks.
Then tell her it's not possible and treat it yourself. Where is she?
I don't know.
Murphy's bitten, Edwards is blind, and you're bonkers.
No,
Another one down.
If you don't, I'll have to go through all Dr. Brooks' charts. How about you save me all that trouble and tell me your name?
She'll come.
They're really hitting that creepy.
Goes through the accessory lobe.
That's the middle lobe.
Right. It's the right lung.
I don't know what I'm gonna be for Halloween this year. Shit.
Driving in England. You know, I have to keep.
I normally have it figured out by now.
The move that I make is going to take twice as long as it should.
Okay.
Stay vascular clamp, please.
Okay. Oh, watch out for the S. SBC.
The SBC shouldn't even be there.
I got you this, so you don't have to shut your eyes so tight, and you don't have to see. You want to try it?
Philip loved it. His favorite holiday. He always needed a costume they didn't sell in the stores, and I always needed to make it. What's happening?
It's okay. We're just, we're going to take a little walk. We're going to go down to the OR and get you a gown. Is that okay?
Yeah.
So you made all of his costumes from scratch, huh? What did he go as?
Well, 1 year he went as an art department.
Well done.
Is she gonna be here overnight? It's just that her dad wants to know if he should change his flight.
Yeah, his 8-year-old has a potentially surgical abdomen. She needs a CT. She's in pain. He should change his flight.
Dude, what is your problem? Pretend that you're not angry and hurt and about to explode. I've been doing that. It's not working. Tell me.
Fight,
to make this better.
Fight back.
Yes. If you segmented the wings, then she'd flap when she moves.
She just has to look like a butterfly. She doesn't actually have to fly. How'd you spend the time off?
Yeah, I just made it happen. Halloween was always my favorite night as a kid, and I just wanted to spend it with my family, you know?
Halloween is awesome.
You're sushi your butterfly costume.
Those freaking older people.
Attach this to her wrist.
Some are my age, some are a little younger than me. Not literally older people. I mean, not kids.
It's totally worth it.
Who are like, you're too old to be dressing up. Shut up. Shut up.
Incompetent. It's not the fault because it's how they were raised. And everyone gets a trophy just for being on the soccer team.
They're not the problem. You are. I'm trying to teach them, and you won't let them learn. I can barely get out of this bed. Can't operate. Who knows if I ever will.
You're not kicking me off this case.
Yes, I am. This is why when I fire someone, I like to do it in their office. So I can walk out. Walk out daily. Now.
Wow, there is barely any necrotic tissue here. The maggots might have actually saved her leg.
Well, remind me, some flowers. We may actually make trick-or-treating tonight.
Yeah, about that. I'm bowing out tonight. Taking one for the team.
Are you sure there's gonna be a piñata?
Shut up.
And pin the head on the skeleton.
Damn it, they're so cute when they're blindfolded.
Bobby for apples.
Aww.
Right? It's Dr. Weber. He's asking whether you have room on your schedule for a cystogastrostomy.
Maybe Derek can take pictures.
You get your lab back?
Nope. The post-exposure counselor gave me this cheerful little pamphlet on antiviral drugs to read while I'm waiting.
Look at y'all.
She said in case I do have HIV, it might not be a bad idea to start taking it now. You probably don't have HIV. The counselor said there are plenty of other healthcare jobs available apart from surgery.
Like what?
Like post-exposure counseling.
But I won't know which pamphlets to hand out if I can't read them.
Girl, you're not gonna have that forever.
We're screwed.
So screwed.
What is she talking about?
Yeah, let's go ahead and prep the synthetic graft.
Okay, starting it now.
Sure is Dr. Avery.
That's like her 15th misspelled text.
She's scared. Tell her not to call, everything's gonna be fine, and to keep using her eye drops. You know, and tell her that she's beautiful. What?
Who are you?
This is supposed to be fun,
You're
man.
overcomplicating it. Just tell your left hand to do what your right hand usually does. Haven't you practiced operating with both hands?
Do what the right hand usually does.
Yes, I have practiced with both hands, but I can't just...
I'm sorry, I can't do it.
Meredith, I just need you to...
I understand what you're asking me.
Meredith.
Page the general surgeon that's on call. I don't have the time.
I'm sorry. I'm sorry for saying that you were the wrong choice to be in charge of my care. For saying that you should have let me die.
Damn it, Meredith.
What is that, a fan?
Exactly.
You're
Ray is a fan.
her time. She has no time.
A burr hole and open up under the skull.
Adrenal glands are enlarged with high potassium, low glucose, adrenal insufficiency. Her body's not producing enough adrenaline.
Glad you can read.
But there's no tumor.
Bro.
Unless it's an infection, maybe blastomycosis. Oh god, her dad mentioned that they just went to Brazil.
Are you kidding me?
Thanks for your help, and I'm sorry about the last minute cancellation.
Where is she?
She was just here.
So scared.
You said that she started to feel sick last night, watching the scary movie.
She wanted to watch.
She's wandering through the hospital on Halloween. Look, if something frightens her, she could go into shock.
She could get scared to death.
We gotta go find her.
I'm looking for a crazy lady with weird eyes.
No, seriously, she disappeared again. Get it.
Stop. She's probably a stray. Heather was always taking them in. The homeless, the uninsured.
Oh god, watch the door. Oh, I thought she was gonna. Ah, shit. This isn't freaky. Great. Because that's what we needed.
Give me that gurney.
Right away, Doc.
She's in shock from adrenal crisis. Give me your blood pressure and get those fluids started.
I'm on it.
Respiratory wheezing. Get her on 5-liter O2.
Systolic frequency.
I need an IV hydrocortisone and a central line kit.
Do you want me to stay?
Don't you have kids to get to for Halloween?
Yeah, but you know, it's okay.
Oh no, you don't want to miss it. You only get 10 before they go off on Halloween with their friends getting into trouble. You gotta enjoy it while you can.
If you're coming to the party, could you bring cupcakes? If not, no problem. What does that mean? It's no problem if I don't go, or no problem if I don't bring cupcakes?
No problem if you
And
don't
if
bring
I don't go,
cupcakes.
then there's no cupcakes?
Oh god.
Or will someone else bring them? And if someone else is bringing them, why is she even asking me?
Don't overcomplicate it.
Yeah.
Just go.
It's literally what it means.
The cortisone will prevent.
It's like, we don't really need the cupcakes, but if you're coming, we forgot the
I never would have taken
cupcakes.
you to Brazil with me if I'd known she could get sick. It was one bad call. That's all it was, just one bad call. Look at that.
Don't let what Dr. Krebs said. He's so good with kids, but just so crappy with other people.
He's struggling.
Face fixed. Not quite yet. Our first priority was repairing your injured carotid, which was damaged when you were attacked.
Oh, God. I've been quarantined, haven't I? Oh, God, I knew it. I saw this thing on cable about these rituals in Haiti, and I thought they were all crap, but you got me quarantined, sort of, don't they? Because that's what they do, the CDC. They don't want you to tell
Victor! Hey! Listen to me! Victor, you are not under quarantine. You are in the ICU, which is where we take patients after surgery.
Random.
Yeah, completely random, and also not in the least bit supernatural. And really, honestly, when you think about it, isn't that like 100 times scarier than some zombie apocalypse?
Yeah.
Kind of,
Yeah,
but not really. Well done, April. Queen.
Someone starts spinning out, you just shut it down.
Great! Well, I have to find a resident to do every pseudo-sister. I'm not even going to make it to trick or treat.
Go! See you at the house.
Okay.
It should be Joe. Or Ross, either one.
Can I talk to you about Alex?
Yes. I know a place we can go where no one will interrupt us.
Welcome to my laboratory. That's great. Mommy, been doing all this.
Well, look at you, Dr. Crazy Person. You look so good. Okay, go and get your trick-or-treat bag now.
I would too.
Right? I mean, it's holidays and weekends crap. I'm only back here in Seattle. You guys.
Yeah, I know, but well, you can't drop out of residency in the middle. In a few years, we'll...
I did. I quit.
You what? Hey, have you seen
Oh,
Wilson?
she's not gonna like that.
What's wrong?
Nothing's wrong. I'm fine.
You're crying.
It's nothing. I'm fine. and I'm waiting for the guy's HIV results.
Why didn't you tell me?
I'm trying to be easy peasy.
Easy peasy. Lemon squeezy. Ooh wee.
My first needle stick happened on a Tuesday. It was
Tuesday?
the second month of my 3rd year in my internal medicine rotation. We had just switched over to these retractable needles, and when I went to put his into the hazardous waste, I didn't retract it right. And it jammed right into my palm. And my whole body went cold.
Damn.
Dr. Brooks died 3 months ago.
Oh, that can't be true.
You're not in the charts. She was treating you under the table, right?
I didn't want to get into trouble.
When you run out, you come back, you find me. I'll be your doctor now.
Damn.
She was a very good doctor. Are you as good as she was?
But I will.
Damn. That's a really good moment for him.
Take your time. Can I tell you a thing about Alex? He doesn't want me to tell anyone, but I don't know what to do. He keeps pushing me away.
You know, she's not the only one there.
I do. Can't tell me. I can't. No, I mean, he's the worst thing you could do. If he told you, he trusted you, so whatever it is, you have to be the one to deal with it. I mean, of course he's going to push you away because he hates being vulnerable. But that's when he's going to need you to stick with him the most. I'll keep trying. Well, you're going to have to do better than try because my plate is full. I have too many kids.
My life is happy, and I'm elsewhere.
You don't love it?
You? Of course I do.
No, not me. Surgery. You left town a week after we got married to learn surgery because you were in love with him.
Miranda, what?
Disappointed in you.
I knew she was not gonna like that.
Can we go trick-or-treating now?
You are so cute.
I can't do complicated right now. I don't even want to think about complicated. And that is what is so great about you, is that you're so easy. God, I came out wrong. I don't mean you're easy, I mean you're simple. Delete this.
That was a disaster.
How'd you do?
Okay, well, we started your incision using...
Start from the very beginning. Where'd you place the pores?
Well, we took
I was about to say that. I was like, just
and
walk
decided
away.
to place the xiphoid for ladder.
There's a surprise around every corner.
Yeehaw.
Rapid test negative.
Why are you a clown?
I have to go back in 6 months to get tested again to be sure, but it's looking good. Dude, I'm waiting for my boy.
Hi.
Oh, damn it. Oh, screwed. So screwed. What?
You knew that I was going to take the whole day off of you, right? We just spent the entire day at home, on the couch while I made you chicken soup, and you watched movies and slept it off. But now you had to come to work. You had to stress yourself out and strain your eyes and make yourself miserable, which I told you was going to happen.
Hey, look, a little space princess.
Go to mommy. Hi. Do you want your wine?
She doesn't feel like she belongs.
And some of the surprises are bad.
Are you gonna stay here and hand out candy?
No, I'm gonna eat candy in the dark and pretend like I'm not home.
Alex.
Don't pass out your freaking candy, relax.
What's important is that you can't let the fear of the surprise stop you from getting dressed up. And wandering up to a stranger's house to ask the question.
What are you supposed to do?
Sexy. Which?
You didn't have something else to do tonight?
There are many options, Sharky.
What are you? Oh, are you a knight?
But the scene
Maybe.
must come.
Samurai? Samurai. Samurai!
Tequila?
That's weird.
Lights are off!
I made a bad call. I should have let you walk away, but I never would have pushed you towards him if I thought you'd end up hurt. I didn't see it coming. You did, and I am so sorry. But it was one crappy call. That's all.
So what'll it be? Trick? Or treat?
Oh, she's so beautiful!
Just think that I'm home.
That woman is freaking gorgeous. God. She is so pretty. Oh my god. I have, like... I crush on people. I've watched a lot of shows. I have crushes on shows all the time. There are some people who are just... It's like I don't know, like a goddess or something. And she's one of them. She's like one of the most beautiful people I have ever seen. She is so pretty. She's top 3, hands down. One of the most prettiest people I've ever seen. Her, Ella Langley. There's others, but the list is not long. Like, crushes? How many crushes have I had? A lot. The, like, drop-dead, absolutely gorgeous people I've seen, I feel like there might be 5. Maybe 6. I don't know. Like, she is so pretty. It's like she's not real. It's like a crime. You're not supposed to be... No one's supposed to be that beautiful in, like, every single aspect. Like, you got people who are beautiful, like, a lot of times, but they do something and, like, I don't know, they have, like, messy hair or something, and you're like, we all have those days, some more than others. She could do, I feel like, anything, and she looks absolutely beautiful. Like, that doesn't happen. It's so unfair. It's like, oh man, I don't even remember what happened in that episode. I got distracted. Oh yeah, the zombie. Yeah, zombie, maggots. I mean, this was the exact Grey's Anatomy Halloween episode that you could have gotten. Not much to talk about there. There is something to talk about, though. Ross and Yang? Please no. Please no. No. That's weird. That is really weird to me. And is it weird for me saying that I don't see Ross with anybody? At least who's currently on the show? I don't see it. Anyways, like the video, comment down below, subscribe if you have not already. See y'all next time.